Hello and welcome to this video on hair fall. Hair is an important aspect of our appearance and our self-esteem, and losing it can be a distressing experience. Hair fall is a common problem affecting millions of people, and it can happen to anyone regardless of age or gender. In this video, we will explore the causes of hair fall, its symptoms, diagnosis, prevention, and treatment options. So, whether you're experiencing hair loss yourself, or just looking for ways to maintain healthy hair, this video is for you. Hair fall refers to the loss of hair from the scalp and is a natural process that occurs to everyone. The human scalp has around 100,000 hair follicles that grow hair continuously in a cycle of growth, rest, and shedding. It is normal to lose 50 to 100 hairs a day as part of this cycle. However, when the hair fall exceeds this normal range, it can result in thinning or bald patches, which can be a cause for concern. Hair fall can happen due to various factors, including genetics, hormonal imbalances, poor hair care, medical conditions, and stress. Regardless of the cause, hair fall can have a significant impact on a person's self-esteem and quality of life, which is why it's important to understand and address the issue. Hair health is an important aspect of our overall well-being, and it can say a lot about our lifestyle and health status. Healthy hair is shiny, full, and resilient, while unhealthy hair is brittle, dull, and prone to breakage. Maintaining healthy hair is not just about appearance, but it also helps us feel confident and attractive. Moreover, hair is also a reflection of our internal health. For example, hair can be affected by nutritional deficiencies, hormonal imbalances, and underlying medical conditions. Taking care of our hair can also help us identify and address these health issues, which can prevent more serious problems in the future. Hair fall can have many different causes, and understanding these can help us find the best solution for our individual needs. Some of the most common causes of hair fall include: Number 1 is genetics. Hereditary hair loss is the most common cause of hair fall, and it is often passed down from one generation to the next. Number 2. Hormonal imbalances. Hormonal changes, such as those that occur during pregnancy, menopause, or thyroid disorders, can cause hair fall. Number 3. Poor hair care. Overuse of styling products, excessive heat exposure, and harsh chemical treatments can damage hair and lead to hair fall. Number 4. Medical conditions. Certain medical conditions, such as anemia, autoimmune disorders, and scalp infections, can cause hair fall. Number 5. Stress. Physical and emotional stress can cause hair fall, as it can affect the hair cycle and trigger temporary hair loss. It is important to identify the cause of hair fall so that an effective treatment plan can be developed. In some cases, multiple factors may be contributing to hair loss, and a combination of treatments may be needed to achieve the best results. Hair fall can manifest in different ways, and it is important to identify its symptoms to seek the right treatment. Some common symptoms of hair fall include: Number 1. Thinning of hair. Hair may become finer and less dense, leading to noticeable thinning and scalp visibility. Number 2. Excessive shedding. Losing more hair than usual, especially when brushing or washing, is a sign of excessive shedding. Number 3. Receding hairline. A noticeable recession of the hairline, especially at the temples, can be a sign of hair loss. Diagnosing of hair fall. Diagnosing the cause of hair fall is an important step in finding the right treatment. The diagnosis process typically involves a thorough medical history, physical examination, and in some cases, additional tests. During the medical history, the doctor may ask about any underlying health conditions, medications, and hair care routine. A physical examination of the scalp and hair can help identify any underlying conditions, such as scalp infections or hair breakage. In some cases, additional tests may be required to determine the cause of hair fall. These tests may include a blood test to check for hormonal imbalances or nutritional deficiencies, a scalp biopsy to identify any scalp infections, or a pull test to determine the extent of hair loss. Once the cause of hair fall has been determined, the doctor can develop a personalized treatment plan that may include medications, lifestyle changes, or hair restoration treatments. It is important to work with a hair specialist to ensure an accurate diagnosis and effective treatment plan. Prevention and treatment. Preventing and treating hair fall depends on the underlying cause of the problem. Some steps that can help prevent hair fall include: 1. Proper hair care. Using gentle hair care products, Avoiding excessive heat exposure and limiting chemical treatments can help prevent hair damage and preserve hair health. 2. Healthy diet. Consuming a balanced diet rich in vitamins and minerals, such as iron, biotin, and vitamin D, can help promote hair growth and prevent hair loss. 3. Stress management. Managing stress through exercise, meditation, or other relaxation techniques can help prevent stress-related hair loss. If hair fall is already present, the treatment options will depend on the cause of the problem. Some common treatments include: 1. Medications. Certain medications, such as minoxidil or finasteride, can help stimulate hair growth and slow down hair loss. 2. Hair restoration treatments. Hair restoration treatments, such as hair transplantation, scalp micropigmentation, or hair extensions, can help restore the appearance of fuller hair. 3. Lifestyle changes. Making changes to your lifestyle, such as improving your diet or reducing stress, can help improve hair health and prevent hair loss. It is important to seek professional help from a hair specialist to determine the best course of action for your individual needs. With the right treatment and care, hair loss can be prevented or effectively treated, resulting in fuller, healthier hair. Hair fall can be a concern for many people, but the good news is that there are steps that can be taken to prevent or treat the problem. Whether the cause is genetics, hormonal imbalances, poor hair care, or a medical condition, there is a solution available. It is important to understand the symptoms of hair fall, seek a proper diagnosis, and work with a hair specialist to determine the best course of action. With the right treatment and care, hair loss can be prevented or effectively treated, resulting in fuller, healthier hair. Thank you for watching, and we hope this video has been informative and helpful in your journey to better hair health.